have a question for you. This is from the Wall Street Journal.
All right.
Thursday. Betsy McLaughlin. Last September, Senator Barack Obama promised that under his health care proposal, you'll be able to get the same kind of coverage that members of Congress get themselves.
Yep.
On Monday, President Obama repeated the promise in a speech to the AMA, American Medical Association.
Yep.
It's not true, this is what Betsy said. The President is barnstorming the nation urging swift approval of the legislation taking shape in Congress. The legislation, the Affordable Health Choice Act, that's being drafted by Senator Kennedy's staff and his Health Education Labor Pension Committee, will push Americans into stingy insurance plans with tight HMO-style controls. It specifically exempts members of Congress along with federal employees. The exemptions are in Section 3116. Will you give us our word today that when they sign the new National Health Care Choice Act, that you will relinquish your federal health plan and sign up on this new plan? Will you give us your
I don't
word?
I don't take the federal plan right now, so I don't take
what
the plan
do you take now?
So I'm on my wife's health care.
Okay, you're on
It's true. It's better than the federal plan. I'll be honest with you. For all the talk about how great it is, my wife's nonprofit health care is actually better than the federal plan. But your question is a good one, right?
My question is, why are federal employees and members of Congress allowed to opt out of this plan here and have their own?
You're saying that that's in the draft of the Senate bill?
Section 3116, it exempts members of Congress along with federal employees.
Yeah, that's the Senate bill. I haven't read every bit of the Senate bill that came out about it.
Members of Congress enjoy the widest selection of health plans in the country according to the U.S. Office of Personnel Management. They can choose from among consumer-driven, high-deductible plans that offer catastrophic risk protection to higher deductibles, health-saving reimbursement accounts, lower premiums, or fee-for-service plans, and their preferred provider organizations, PFOs or health maintenance organizations, HMOs.
I'd be interested to see if the Senate plan exempts the federal employee health benefit network from this new insurance regulatory system they're setting up. But the idea is that if you want to keep your health care, right, that you keep it. Nobody's going to take that away from you.
But what's going to happen is the cost of the federal plan is going to become so inviting because the cost will be substantially lower than the private plan.
Drive those private plans out of it.
They'll be out of business.
So you got it. So
maybe they might out of business if they want to keep talking and spending big bucks on big CEOs to they really don't do anything.
No, I agree with you on that, but let me just say this: I've had private health plans since I was 16 years old. I've had no complaint with them.
The only complaint I have with them is in the last 10 years, my cost has doubled, and when my salary has only gone up about 10 to 15%.